This video is to cover a couple things to consider when you have recently had a C-section. So this is early postpartum. This probably still applies. I mean, it does still apply if you've had a vaginal delivery, but we're here talking about C-sections and C-sections for you, okay? So early meaning between that 0 to 6 week mark, before you've kind of been cleared to exercise, but all of this can still apply for whatever amount of time it takes for your body to recover, because everybody is totally different, and 6 weeks is just some day that has been chosen, and it doesn't mean that everything should be better by then, okay? So first off, we know that major abdominal surgery is not an easy thing to go through or recover from, and we know that it's really scary to have to move afterwards. But circulation is super important to prevent blood clots, to help with digestion, and also for the sake of your mental health. So a couple tips that I can say is, if you're lying in bed and you're wondering what to do, some gentle movements can include, like, imagine I'm lying down, ankle pumps, ankle circles, gentle heel slides, moving your legs in and out. That would be probably a good place to start, because we know that ankle pumps helps to make sure that we're preventing blood clots from happening, and typically they happen at our extremities, okay? The second piece is when you go to stand up, because you have to, because even if you had a C-section delivery or a vaginal delivery, you still have a baby to take care of. So ask for help is going to be my first mention. And second is, when you're going to stand up, actually just try to stand up straight. We know that when we're scared and protective of an area of our body that's injured, we tend to guard, and a lot of people can stay really flexed. So trying to use a chair or your bed or whatever it is to exhale and stand up tall is a great place to start, okay? Inhale, exhale. Try when you can, especially in eventually that first week, try and move as normally as you can, but slowly, okay? Because we don't want any tightness to happen just because we're protectively caring for a part of our body, okay? On that same note, blow before you go is a really great thing to keep in mind. So exhaling informs our body that things are okay, right? So we're using our diaphragm, and it can also be a way to blow out pressure. So if you've had a vaginal or C-section delivery, exhaling can help blow pressure out of your mouth. It can also help with pain management. So if you are coming up out of bed, think exhale and stand up. If you're going to pick up your baby, same thing. Try and exhale the pressure out. It really does help with pain sensations, and if you are really inflamed and in that early recovery, and also with some fear around what we're actually doing. Bracing and being really hypervigilant isn't going to do you any favors, okay? On that note, because there is a healing incision on our body, we might still end up needing to cough or sneeze or poo or do things that increase pressure in our abdomen. And since our core is responsible for containing that pressure, it might feel really vulnerable to have to do those things. So there's a trick that they use in people that have rib injuries, like a broken rib. All those things still hurt when you have a broken rib. And so what they do is they splint, and they'll use a pillow to splint the area when they have to cough, sneeze, laugh, or poo. And the same thing can apply for C-sections. It's nice to kind of have something to push against, and to also just have that reinforcement when you're doing something that has more pressure. The last thing I want to mention is that you might just be wondering where to start. And although there is no rush on where to start, we know that you're still a functioning human. And in order for your mental health and your body to continue to improve during these early days, the best place to start is just focusing on some deep breathing. It sounds lame, but it's super not. Your nervous system is wound up. Your body is recovering. There's a lot of reasons why your nervous system right now is just like, ee! So taking some deep breaths, I have a couple videos on the Frank platform of just like gentle mobility, but also just diaphragmatic breathing, especially the first half of that video, which is just inhale, breathe into your trunk, let your diaphragm expand, let your belly relax, let your pelvic floor release. Exhale, let it go more. Create safety in being able to mobilize these parts of our body because your breath is never going to injure you. You're not going to be able to breathe at like high velocity with high force that puts a muscle at risk, right? So nice deep breaths will be a really great way to explore what parts of your body are you feeling really protective towards, and that's okay, but maybe that's where the work needs to start, is how can I breathe into that part of my body, right? Trust the incision, trust that everything is okay, and we're not trying to like clench anything or do anything super aggressive, just a breath. The actual other really nice piece is that your diaphragm and your nervous system are related. Your diaphragm is innervated by your parasympathetic rest and digest nervous system. So that's like, you might be in this fight or flight state, but diaphragmatic breathing is a really great way to just help yourself be more towards this like rest and restore and I'm okay kind of sense of being. All right. So those are my 6 tips. Check out the rest of the gentle mobility videos and the deep breaths for this early phase. And then as you get the clearance to exercise, you can start the week 1 to 6 more strength specific exercises. Guidelines: make sure that nothing is increasing your bleeding. Make sure that you're not having any sharp shooting pain. Make sure that you're not using dirty fingers on your incision. And eventually, yes, we want to start mobilizing that scar, but for now, just let that scar heal. Movement is a really great way to heal things in your body. Okay?